The unseen, Lexington beyond the bluegrass charm, Lexington, Kentucky. The name itself often conjures images of rolling green pastures. White fenced horse farms stretch as far as the eye can see. It's a city known for its thoroughbred champions and its distinct southern gentility. This is the Lexington many tourists see, the postcard image carefully curated and proudly displayed. The city boasts a vibrant downtown, historic architecture, and a spirit of warm hospitality. Yet beneath this veneer of prosperity and undeniable beauty, a different reality exists. It's a reality that is often hidden from view, tucked away in the shadows of progress. A crisis of homelessness is growing, challenging the very fabric of this community. This isn't just a Lexington problem, it's a human problem playing out in a city many hold dear. The stunning landscapes and the thriving equestrian industry can sometimes mask the struggles of its most vulnerable residents. We must look beyond the idyllic scenery to understand the complex issues at play. The contrast between the city's outward beauty and the quiet desperation of those without a home is stark. It's a narrative of two cities coexisting, one celebrated and one largely ignored. Ignoring this crisis is no longer an option for a community that prides itself on compassion. The issue of homelessness touches everyone, whether directly or indirectly. It impacts the local economy, strains public services, and most importantly, it reflects on our collective humanity. For those of us over 50 who have seen communities change and grow, the call to address such fundamental challenges often resonates deeply. We understand the importance of a stable home, a supportive community, and the dignity that comes with it. This understanding compels us to look closer and ask difficult questions about how such a crisis can unfold in a place of such apparent abundance and charm. This exploration is not about assigning blame. It is about shedding light, fostering understanding and inspiring action. We will delve into the numbers, the causes, and the faces behind this crisis in Lexington. We will examine the policies that shape the response and the community efforts striving to make a difference. The goal is to unveil the hidden aspects of homelessness in the horse capital of the world. We hope to engage hearts and minds because only through collective awareness and compassionate action can we begin to forge a path toward meaningful solutions for all residents of Lexington. Numbers don't lie. Lexington's escalating homelessness. The scale of homelessness in Lexington is not just a matter of perception. The data paints a clear and concerning picture. As of early 2024, a staggering 3,034 individuals were identified as experiencing homelessness. This represents a significant and alarming increase, up 25.9% from the 2,410 individuals counted in the previous year, 2023. Such a sharp rise in just 12 months signals an accelerating crisis that demands immediate and focused attention from city leaders and community members alike. These aren't just statistics. They represent thousands of interrupted lives, each with a unique story of hardship and unmet needs within our community. Among those 3,034 individuals, a particularly vulnerable group of 511 people were found to be unsheltered. This means they were living in conditions unfit for human habitation, in parks, under bridges, or in precarious makeshift encampments, exposed to the elements and constant insecurity. While the official HUD-mandated point-in-time count conducted on January 29, 2024 reported 825 homeless people, many advocates on the ground suggest this number is a conservative estimate. The true scope of the problem, they argue, is likely even larger, with many individuals slipping through the cracks of official counts, hidden from view but no less in need of support. The trend over a slightly longer period reveals an even more dramatic escalation. Since 2019, overall homelessness in Lexington has surged by a distressing 40%. This indicates that the pressures leading to housing insecurity have been building steadily over the past half-decade. Interestingly, there has been a slight decline in chronic homelessness. individuals experiencing long-term or repeated homelessness, often linked to disabilities, thanks to targeted programs. However, this modest success is overshadowed by the significant increase in the broader homeless population, highlighting new and expanding challenges that current systems are struggling to address effectively. The issue is not confined solely within Lexington's city limits. Surrounding rural counties also reported a substantial number of homeless individuals, with 1,200 counted in 2024. This regional challenge undoubtedly contributes to the numbers seen in Lexington, as individuals from outlying areas may migrate to the city in search of services, shelter, or economic opportunities that are scarce in more rural settings. This interconnectedness underscores the need for comprehensive regional strategies, rather than viewing Lexington's crisis in isolation. The numbers are a clear call to action, demanding a deeper understanding of the forces driving so many into homelessness. Beneath the surface, the tangled roots of homelessness. Understanding the surge in homelessness requires us to look at the complex web of factors that push individuals and families to the brink. A primary driver is the acute shortage of affordable housing across Kentucky, a problem particularly pronounced in Lexington. The entire state faces a deficit of approximately 89,000 affordable housing units. This scarcity has a direct impact on rental costs. Since 2020 alone, median rents in Lexington have skyrocketed by 20%. A modest one-bedroom apartment now typically costs between $900 and $1,200 per month, a sum that is simply out of reach for many hardworking residents. For households earning a low income, perhaps around $30,000 annually, such high rents can consume more than 50% of their monthly income. This leaves families with an impossible choice between paying for housing and affording other basic necessities like food, healthcare, or transportation. Compounding this issue, evictions in Fayette County saw a 15% increase from 2022 to 2023, displacing an estimated 2,500 households. Each eviction notice can be the tipping point that pushes a struggling family from a precarious housing situation into outright homelessness, shattering their stability and sense of security. Economic instability further fuels the crisis. Approximately 15% of Lexington's workforce, equating to around 24,000 people, earns less than $15 an hour. This wage level makes it incredibly difficult to keep pace with the rising cost of living, especially housing. Furthermore, about 10% of the city's population lives below the federal poverty line, which was set at $14,580 for an individual in recent years. When incomes are this low, there is virtually no financial cushion to absorb unexpected expenses, such as a job loss, a medical bill, or a major car repair, making homelessness an ever-present threat. Beyond housing and income, healthcare costs and mental health challenges play significant roles. Medical debt is a pervasive issue, with a 2023 Kaiser Family Foundation study finding it affects 60% of Americans. Kentucky, unfortunately, ranks among the top states for bankruptcy filings directly linked to healthcare expenses. Simultaneously, mental health and addiction crises are deeply intertwined with homelessness. In 2024, nearly 1,000 homeless individuals in Lexington were enrolled in recovery programs, with Kentucky being one of the top 10 states for opioid-related deaths and a severe lack of accessible mental health care. Only 30% of Kentuckians with mental illness receive treatment due to provider shortages. Many vulnerable individuals lack the support systems needed to maintain stability. Faces of the crisis, stories from Lexington's streets. The statistics on homelessness paint a grim picture, but behind every number is a human being with a unique story, hopes, and fears. Among the most rapidly growing demographics facing homelessness in Lexington are seniors aged 62 and older. Their representation in the homeless population increased from just under 4% in 2015 to nearly 6% by 2019. And the trend continues. Many seniors rely on fixed incomes, such as Social Security benefits averaging around $1,200 monthly. These modest sums have not kept pace with the dramatic surge in rental costs, leaving many older residents unable to afford a place to live. A 2023 AARP report highlighted that 20% of Kentucky seniors live below 150% of the poverty line, underscoring their economic vulnerability. Families with children are also tragically affected. In 2023, Fayette County Public Schools identified nearly 1,000 students as homeless or housing insecure. This number has disturbingly doubled since 2015. The instability of homelessness has profound and lasting impacts on a child's education, health, and overall development. Imagine a child trying to focus on schoolwork without knowing where they will sleep that night, or a parent struggling to provide normalcy amidst constant upheaval. These families are often hidden, doubling up with relatives or living in motels. But their struggles are immense, and their need for stable housing is critical for the well-being of the next generation. Our nation's veterans who have served and sacrificed are sadly not immune to this crisis. Despite various federal programs aimed at preventing veteran homelessness, the 2024 survey in Lexington counted 50 veterans among its homeless population. These individuals often face unique challenges, including service-related disabilities, PTSD, and difficulties readjusting to civilian life, all of which can contribute to housing instability. It is a profound societal failing when those who defended our country find themselves without a safe place to call home. Their presence among the homeless underscores the need for more targeted and effective support systems for our veterans. The crisis also reveals significant racial disparities and disproportionately affects women and youth. Black residents, who make up 14% of Lexington's overall population, accounted for a stark 30% of the homeless population in 2024. This disparity points to systemic inequities that must be addressed. Women, particularly those fleeing domestic violence, are also overrepresented, with 200 accessing shelters in Lexington during 2024. Additionally, around 100 youth aging out of the foster care system were identified as homeless in 2024. Lacking family support or established job skills, these young people face an incredibly difficult transition to adulthood, often leading directly to homelessness. Section 5. Policy and its price, the impact of House Bill 5. Local and state policies can significantly influence the landscape of homelessness, either alleviating or exacerbating the crisis. In Kentucky, the enactment of House Bill 5 in 2024, also known as the Safer Kentucky Act, has sparked considerable concern and backlash from human rights advocates and those working directly with the homeless population. This legislation effectively bans camping or sleeping in public spaces such as parks, sidewalks, or under overpasses. Violators face fines of up to $250 and for repeat offenses can be subjected to jail time of up to 90 days. This approach criminalizes the very act of being homeless and unsheltered. The immediate consequences of HB 5 are already being felt on the ground. A 2024 survey revealed that 233 homeless individuals, or 35% of those surveyed, reported experiencing harassment for sleeping outside. A significant 78% of these individuals cited encounters with law enforcement related to their homelessness. Instead of providing pathways to housing, such policies often create a cycle of fines, arrest, and incarceration, making it even more difficult for individuals to escape homelessness. Case managers now report spending approximately 30% more of their time dealing with legal issues their clients face due to this law, diverting resources from housing and support services. Advocates have warned that HB 5 could inadvertently worsen the situation in urban centers like Lexington. By making it illegal to be unsheltered in public spaces across the state, the law may push homeless individuals from rural areas where services are even scarcer into cities that have at least some existing support infrastructure. This influx could increase the demand on Lexington's already strained shelter system by an estimated 10%. Furthermore, the financial burden of enforcing HB 5 falls heavily on local communities. Fayette County taxpayers, who already fund 80% of local homeless services at a cost of $5 million annually, could see these costs rise by an additional 15% due to increased enforcement and jail expenses associated with the new law. National studies support the concerns raised by local advocates. A 2023 report from the National Low-Income Housing Coalition found that punitive laws like HB 5 can actually increase homelessness by as much as 20% in affected areas. Criminalizing homelessness does not solve the underlying issues of poverty, lack of affordable housing, or inadequate mental health care. Instead, it creates additional barriers for individuals seeking stability and can drain public resources that would be better invested in proven solutions like permanent supportive housing and comprehensive support services. The human rights backlash emphasizes that dignity and support, not punishment, are key. Section 6. A city's conscience, Lexington's compassionate response. Despite the daunting challenges, Lexington is not standing idly by. A dedicated network of local government agencies, non-profit organizations, and passionate volunteers is working tirelessly to address the homelessness crisis with compassion and innovation. The City of Lexington established the Office of Homelessness Prevention and Intervention in 2014. This office plays a crucial role in coordinating a wide array of services, including emergency shelters, food programs, and employment assistance. Their winter shelter program, running from November 1st, 2024 to April 1st, 2025, aimed to house 200 people nightly, an increase from 150 the previous winter, and distributes vital supplies like blankets and meals during the coldest months. A key initiative in understanding and responding to the crisis is the annual Lex Count. The most recent count, conducted on January 29, 2025, mobilized an impressive 150 volunteers. These dedicated individuals logged 289 hours, combing the city to identify and survey those experiencing homelessness. Through their efforts, 505 unsheltered individuals were identified, and importantly, 300 care packages containing essential hygiene kits, socks, gloves, and hand warmers were distributed. This annual event not only provides critical data, but also serves as a vital point of contact, offering immediate aid and a human connection to those often feeling invisible. The backbone of the community response is often found in its robust non-profit sector. Organizations like the Catholic Action Center are on the front lines daily, providing 130 shelter beds and serving an astounding 200,000 meals annually. They also offer essential case management services, though they consistently operate at full capacity, highlighting the immense need. Volunteers at the center pack around 500 meals every single day. Similarly, the Lexington Rescue Mission's Jobs for Life program empowers individuals by providing job training to 200 participants each year, with a notable 75% securing employment within 6 months, supported by dedicated mentors. Other vital organizations include the Hope Center, which provides addiction recovery services for 500 clients annually, reporting a 60% success rate in helping individuals reclaim their lives from substance dependency. The Homeless and Housing Coalition of Kentucky, HAHA, plays a broader advocacy and support role. In 2024, its network served 10,000 meals and provided temporary housing for 300 people through its volunteer programs. The community's engagement is further evidenced by numerous donation drives. In 2024, 20 organizations hosted such events, and Fayette County students impressively collected 1,000 hygiene kits. Lexington's top 10 companies also contributed $100,000 to shelters, showcasing a multifaceted, compassionate response. Section 7, the long road ahead, persistent barriers to progress. While Lexington's community response is commendable, significant and persistent barriers continue to hinder progress in effectively resolving the homelessness crisis. One of the most promising strategies, the Housing First program, has shown positive results. It successfully reduced chronic homelessness by 60% since 2015, housing 92 individuals in 2018 compared to 199 in 2015. This approach prioritizes providing stable housing as a foundation before addressing other issues like employment or addiction. However, the demand for Housing First placements far outstrips the available supply of suitable units, leaving many eligible individuals waiting and vulnerable. The critical shortage of affordable housing remains a central obstacle. Lexington's Affordable Housing Trust Fund is actively working to address this, with projects underway to develop 71 new senior housing units and rehabilitate 300 existing apartments. These efforts are vital, but they are a drop in the ocean compared to the overall need. Waiting lists for these affordable units are typically 2 to 3 years long. Furthermore, the rising cost of construction, which has increased by 15% since 2022, makes it even more challenging and expensive to develop new affordable housing projects at the scale required to make a significant dent in the problem. Funding limitations also pose a persistent challenge. Federal funding for Kentucky's homeless programs amounts to approximately $10 million annually. While this sounds substantial, these funds have not kept pace with inflation or the escalating complexity and scope of homelessness. As the number of people needing assistance grows and the cost of providing services increases, the available resources are stretched thinner and thinner. This funding gap impacts everything from shelter operations to the availability of supportive services, forcing organizations to make difficult choices about where to allocate limited resources. Finally, access to adequate mental health care and addiction treatment continues to be a major hurdle. Kentucky faces a severe shortage of mental health professionals, with only 1,200 licensed therapists for the entire state population of 4.5 million. Consequently, an estimated 70% of Kentuckians with mental illness go untreated. Addiction recovery programs, while impactful, currently serve only about 20% of those in need, with around 800 people on waiting lists for treatment in 2024. Transportation barriers exacerbate these issues, as 50% of homeless individuals reported missing crucial appointments in 2024 due to limited bus routes or lack of access to transport, further isolating them from potential help. Section 8. Blueprints for Hope Learning from Other Cities' Successes. Lexington is not alone in its struggle against homelessness, and fortunately other cities have pioneered effective strategies that offer valuable lessons and potential blueprints for hope. Houston, Texas, for example, has achieved remarkable success, reducing its homeless population by an astounding 63% since 2011. Their comprehensive approach involved housing over 27,000 people, constructing 10,000 new affordable units, and fostering partnerships with 1,200 landlords. Crucially, Houston's model integrates job training, mental health support, and addiction treatment services, resulting in 80% of participants remaining housed after 2 years and saving an estimated $15 million in public costs over a decade. Salt Lake City, Utah, provides another inspiring example, particularly in tackling chronic homelessness. Between 2005 and 2015, the city cut its chronic homeless numbers by an incredible 91%. Their success was largely attributed to a robust Housing First approach backed by $20 million in dedicated funding. This initiative provided 1,000 apartments coupled with comprehensive wraparound services, including case management and healthcare access. A significant outcome of this investment was a 50% reduction in emergency room visits among the formerly homeless population, demonstrating both the human and economic benefits of providing stable housing and support. Phoenix, Arizona has made significant strides in addressing veteran homelessness, reducing it by 40% since 2015. Their strategy heavily relies on strong partnerships with the Department of Veterans Affairs, VA, and the implementation of rapid rehousing programs. These programs focus on quickly moving veterans and their families into permanent housing, providing short-term rental assistance and supportive services to help them achieve stability. This targeted approach shows the effectiveness of tailoring solutions to the specific needs of different demographic groups within the homeless population. A lesson Lexington could certainly adapt for its 50 homeless veterans. Drawing from these successes, several potential solutions have been proposed for Lexington. These include expanding the Affordable Housing Trust Fund with a goal of building 500 new affordable units annually, increasing the number of mental health and addiction providers by at least 50 practitioners would help close the treatment gap. Thoughtful reform of House Bill 5, prioritizing housing solutions over punitive measures, could potentially save $1 million in enforcement costs. Further, growing LexCount's volunteer base to 300 dedicated individuals and incentivizing landlords to make 200 additional units available yearly are also key. A centralized client database could improve service coordination, aiming to cut homelessness by 50% by 2030, thereby housing 1,500 people. Section 9. Answering the call, how we can forge a path home. The challenge of homelessness in Lexington is significant, but it is not insurmountable. The path toward meaningful change is paved with awareness, compassion, and collective action from every member of our community. For those of us who value a strong, supportive community, particularly our over 50 audience who bring a wealth of experience and a deep sense of civic duty, there are tangible ways to make a profound difference. Awareness campaigns like those run by the Homeless and Housing Coalition of Kentucky, HHSEEK, which reached 50,000 Kentuckians in 2024 and led to a 20% increase in donations, demonstrate the power of an informed public. One of the most direct ways to help is by volunteering your time and skills. The city's Office of Homelessness Prevention and Intervention, located at 101 East Vine Street, can connect you with various opportunities. Consider joining the efforts at the Catholic Action Center, where volunteers pack 500 meals daily, providing essential sustenance to those in need. The Lexington Rescue Mission also seeks mentors to support the 50 job seekers participating in their Jobs for Life program each month. Your presence and guidance can offer hope and practical support to someone striving to rebuild their life. Even a few hours can have a significant impact. Donations are also critically important, but it's always best to contact organizations directly to understand their most pressing needs. Items like new socks, hygiene kits, soap, toothbrush, toothpaste, deodorant, and warm winter coats are consistently in high demand, especially during the colder months. Financial contributions, no matter the size, allow organizations to flexibly allocate resources where they are most needed, whether for operational costs, specific programs, or emergency assistance for individuals and families on the brink of homelessness. Consider funding a job training scholarship through the Lexington Rescue Mission. $500 can equip one participant with vital skills. Finally, advocacy plays a crucial role in driving systemic change. Support the campaigns led by organizations like HICK, which are advocating for increased investment in affordable housing, aiming for 1,000 new units by 2030. Voice your opinions to local and state elected officials regarding policies like House Bill 5, emphasizing the need for compassionate, housing-focused solutions rather than punitive measures. By raising our collective voice, we can help shape a more just and supportive environment for everyone in Lexington. The crisis of homelessness is a community challenge, and it requires a compassionate, united community response to forge a path home for our neighbors in need.